Good morning. I'm Lloyd Minor, Dean of Medicine at Stanford, and it's a privilege and honor to welcome you here to the second ChildX conference. I want to extend a very, very special thanks to Dr. Hugh Obradovich and other members of the Stanford Child Health Research Institute who organized today's conference. As an academic medical center with a premier children's hospital, Stanford Medicine is poised and is bringing the very best advances in fundamental research, translational research, clinical care to the benefit of our patients. And through the research and education that we do, to the benefit of children and expectant mothers around the world. We hope in these next couple of days to be able to share with you some of the exciting advances in fields such as obstetrics, neonatology, perinatal biology with you during this conference. And we also have the opportunity in the next couple of days to welcome guests and leaders from other institutions to share with us the exciting things that they're doing. We're all in this boat together. We all have the goal to dramatically improve the health of children and expectant mothers around the world. Our vision at Stanford Medicine is to lead the biomedical revolution in precision health. And precision health begins at conception. And as we learn more and more about the determinants of disease, it becomes more and more evident that what goes on from conception through the first, say, 5-6 years of life is defining in terms of the next 60, 70, 80, 90 years of life. And so our ability really to have impact on health throughout the lifespan for sure begins at conception, maternal health, and then child health. And what an exciting time it is to do that here at Stanford. Precision health takes the enablers of genomics, of big data science, of personalization, and applies those enablers in a predictive and proactive way in order to improve the health and lives of individuals everywhere. It's this focus on prediction and prevention and preemption that distinguishes precision health. We've all heard a lot about precision medicine. Well, precision medicine is fundamentally about sick care. And for sure, if one of us or one of our loved ones has a disease like cancer or advanced cardiac disease, we want precision medicine. Precision health is about health care. And we will know a decade from now if we've succeeded in leading the biomedical revolution in precision health, if a lot of the diseases and conditions that today require precision medicine are no longer on the map the way that they are today. I've seen the program, visited with the organizers of the conference today and tomorrow. It's going to be an extraordinarily exciting time. We want to thank each of you for participating. We hope you'll take this opportunity to engage in a lot of dialogue. We've built in time during the schedule for you to meet and greet and interact with each other. And I would view a great outcome from today's conference from today and tomorrow's conference is if each of you comes out of here with a new idea, a new thought, a new way of doing things that you can take back to your daily life and that will impact the effects that you're having on child and maternal health. So at this point, I want to introduce, it's a great privilege and honor to introduce Dr. Hugh Obradovich, who is the chair of the Department of Pediatrics at Stanford School of Medicine and also the director of the Stanford Child Health Research Institute. Hugh.
Thank you, Lloyd. Good morning, everyone. I'd like to echo Dean Minor's welcome to everybody here to the second annual ChildX conference. And as Lloyd mentioned, I have the distinct pleasure of being the director of the Child Health Research Institute. We spent some time a few years ago deciding what should be the mission and goal of the children's health Research Institute, and we decided that there was a simple line for this. Simply put, to launch healthy lives. And where better could we start talking about this discussion by at the earliest point of conception, taking us through the various stages of life, from the fetal development through to the early stages of childhood, adolescence, and going on. And this will be the themes of the next 4 Child X Symposiums, specifically to take the developmental pathways from the earliest point up to adult life, and each year to take an epoch of this and to develop themes which we can help design new strategies to optimize maternal and child health. The Child Health Research Institute is an exciting enterprise because we not only focus on the School of Medicine, but rather draw in all the other 6 schools at Stanford University to work together on a common approach, a common goal to launch healthy lives. Stanford is blessed to be within Silicon Valley, where we have some of the nation's most innovative entrepreneurs, exciting leaders that can help drive these findings forward. We also live within an exciting country where we can expand and reach beyond that and throughout the world. And I hope that you see today that we've reached around the world to bring the best thinkers to come here and help us walk through these problems, and see how that we can design better solutions for maternal and child health. I hope that you have an exciting time today and tomorrow, and look forward for the discussions to it. As Dean Miner said, there's been a team that's been put together to help organize today's conference, and I'd like to introduce the first, if you will, leader of the main 4 that have been leading this, Dr. Chris Contag. Chris is a professor of pediatrics, and as you'll see later on, quite an innovator in biomedical revolution. He and his colleagues have organized today, and I'm just so pleased to have him moderate the first session from early conception to early. Chris, welcome. Thank you.
Thanks, Hugh. Thanks, Hugh, and thanks, Lloyd, for really opening up the session in a beautiful way. It was really fun to put this symposium together. I had a great group of people working with me: Mary Leonard, Dennis Wall, Gary Shaw, Gary Darmstadt, really an incredible group of faculty that helped put this together today. And I think you'll see a tremendous number of themes coming out that really touch many aspects of the work that these people do. We've been interested in working on solutions to health issues and pediatric health issues in particular. And as a father of 3 really amazing kids, now adult children, I've had the opportunity to watch child development up close and personal. My wife and I are both scientists, and we've cloned genes, bacteria, cells, mice, and we refer to our 3 children as our 3 most important cloning experiments, and it's been really fun to watch them. So as with any good cloning experiment, you know a little bit about the genetics and the background. You try to learn as much as you can. And for in the case of our children, we're really thinking about family history, the family health, and then you watch your children in different environments as they grow and develop. And sometimes you change those growth conditions and ask how they respond and study their response. Of course, you can't tell them you're changing the growth conditions. Just kidding. In an experiment you can, but with your children you do. But the conditions change nonetheless. You still have changing environments. And that'll be the focus of one of the sessions tomorrow is watching child development in a changing environment. And so this has been kind of the focus of the planning for the Child X Symposia today and then tomorrow, as well as the ensuing years, is to try to really focus on what happens and what we can control in child development, child health. And the things that we can't yet control, the things that we need to learn more about so that we can begin to control these features and actually begin to work towards precision health, as Lloyd Miner pointed out so beautifully in his introduction.